What do you make of where the vaccine rollout is at? Are you encouraged by some of those numbers you're seeing there?
Oh, absolutely. I think we've made some good inroads in the last few weeks. I think it's clear that a perception of risk in this country has gone up quite significantly with what we've seen in a few states over recent times. And so if that gets people motivated to go and get vaccinated, that's a good thing potentially. And I think we're making some good inroads with supply. And of course, great news to hear about Moderna yesterday.
Yeah, so with the Moderna vaccine, do you see that being used largely as a booster to top up the rollout generally, but from next year they'll be largely boosters, won't they?
Well, I think that was the initial thought, but given the provisional approval yesterday and the fact that we should have some of those maybe even next month, and I think by then there'll still be a lot of people who are yet to receive their first vaccines, and of course with the Pfizer supply still being a little bit tenuous, it's quite possible that those Moderna vaccines may constitute people's first doses. So I guess it depends on exactly when they come and what the situation is then, but it's great to see another vaccine approved here that will certainly help us with supply.
And in terms of the trajectory, the percentage of the population that will be covered, what's your sense of where we'll get to?
I mean, I think we have to aim high. I think there's lots of great modelling that would suggest that around 70% or a little bit over, our reliance on lockdowns will be far less, if anything. But if we can get to 80 or above 80, then we can go back to, obviously not back to completely normal, but a much better way of life and a lot closer to normal with still some basic mitigation strategies to keep everybody safe. We can certainly enjoy a lot more freedom. So I think we certainly need to aim high, and I think based on some current improvements that we've seen in recent times, that really 70 or 80 by the end of the year is something that will still be a bit of a challenge, but certainly one that's possible.
Let's look at the situation, the various outbreaks. I'll start in your home state of Queensland. What's the update you've got there? Obviously, a little bit of a scare in far north Queensland, but are things under control generally in terms of these outbreaks?
I think so. I think we've done a tremendous job here. I think it's a good example of when all of these things go according to plan. So locking down early, I think, was the right thing to do. We obviously had masks in place before this current cluster, which certainly made a big difference. Not enough to prevent it, of course, but certainly reduced the impact. And then we got on top of this really quickly. So while we're still seeing some cases, they're largely household transmission in people that have been in quarantine for their entire infectious period. So it's very likely that we've got this under control and it will just fade away. So a good example of when things go according to plan, I guess.
Yep, indeed. Where things haven't gone exactly according to plan, a little south in New South Wales, how concerned are you about the current settings that they're not driving these numbers down, Professor Griffin?
Look, I think it's very concerning. I think at the current trajectory, I read something today that suggested they may be having 800 or 900 cases a day by the end of the month if things don't change. It's clear that those case numbers, the rolling averages, are increasing, and so it would be great to know what to do to turn that off. Obviously, they've been in a lockdown for some time now, so it's really challenging to know what to add to that to get that under control. So yeah, I do think that's a concerning situation.
The Victorian outbreak, the latest, the 6th lockdown, unfortunately, a number of cases infectious while in the community, but still in the early stages. Are you optimistic there?
I think so. Obviously, Victoria have been through this a number of times already, and I think have scaled up their ability to respond, and that's what we're seeing now. So again, it is early days, so impossible to predict exactly what that's going to look like. But I would hope that a response similar to what we saw here in terms of getting that under control, finding all those cases, getting all those people in quarantine, and hopefully seeing fewer and fewer people infectious in the community in the next few days. I mean, we know lockdowns always have a bit of a lag because it's probably 4 or 5 days before we really start to see the impact there. So hopefully over the next few days, those case numbers will fall significantly. There won't be people infectious in the community for long, and they can get things back under control also.
Professor Griffin, just finally, when we don't have that optimistic sort of outlook in terms of the lockdown in Sydney working, what is the tipping point? Where do they have to get to, in your mind, vaccine coverage in order to start easing restrictions? Is that what we're playing for now?
I think it's difficult because I don't think it's as simple as that. I mean, again, it'd be great if they had 80%, but, in addition to seeing that, again, there's a lag between people getting, those shots in their arms and seeing that protection kick in and the epidemiology, the case numbers fall away to a point that's manageable. And so, if the solution is to try and address that primarily through vaccination, you do need high rates, but also there'll still be a lag to get that under control. And you still do need to find cases and isolate them and try and do your contact tracing as best as possible. So, I think either way, it's going to be a big challenge. I think we are getting better, though. I think one thing to point out too is that it looks like we'll have some therapies available soon. So, even if we don't get that under control in the near future, hopefully we'll be able to minimise the impact by also adding in some effective therapies that should be available soon.